Hello everybody, this is Jim from Hanson's Phil-Am Life. You know, at some time everyone needs a doctor and or a hospital. So I want to tell you about the 5 hospitals that you'll need to know about if you will be in the Dumaguete area. Where to find them, what kind of hospital they are, and all that stuff. Here in Dumaguete, doctors and hospitals go together because many of the doctors have their offices in the hospitals. These hospitals should provide you with most necessary medical care and some advanced care. I have also included a map at the end of the video that shows the locations of all 5 hospitals. Okay, these are the 5 hospitals in the Dumaguete area. Number 1, Holy Child Hospital. Holy Child is in downtown Dumaguete and is a 100-bed private hospital with emergency care, so it's open all the time. They do have modern, advanced equipment for many different types of treatment. There was an expat a few years ago that helped out his assistant who needed brain surgery, and this was done at Holy Child, and she did just fine. Number 2, Negros Oriental Provincial Hospital is in the north part of the city and is a 250-bed government hospital, and it also provides care for poor patients. They have state-of-the-art equipment with a new high-tech equipped diagnostic center. It is also a teaching hospital for students from local universities like Silliman or Negros Oriental State University. Number 3 is Silliman University Medical Center. This is located at the north end of Silliman University and is a 150-bed private hospital that was started in 1903 and is one of the top and preferred facilities. It's usually very crowded. Specializing in pediatrics, children, and obstetrics, having babies. This is a training hospital for local universities where students train and do their residency. It produces about 50 doctors and 200 nurses each year. It has various facilities, medical laboratories, surgery rooms, and a pediatric ward. This is a level 3 tertiary private and licensed hospital and has collaborative ties with St. Luke's Medical Center, which is in Manila, and it is the medical center that, say if you get a fiancé visa, your fiancé will have to get her medical at St. Luke's Medical Center. That's the only hospital that the embassy recognizes. Okay. Number 4 is Allied Care Experts, or ACE, Dumaguete Doctors Hospital. They have more hospitals, but this hospital is in Dumaguete. That's why it's called Dumaguete Doctors Hospital. It's located in Daro Barangay, in Perak, Claytown, which is the smaller administrative part of a barangay. It's a level 2 100-bed private hospital that was organized by a group of doctors with the idea of bringing down the cost of healthcare by bigger purchases where they could spread the costs across many hospitals. It has the second MRI in the province. The other was at Negros Oriental Provincial Hospital. And when this hospital opened, the one at Norsu, that's the university, Negros Oriental Provincial Hospital, needed maintenance, but they didn't want to take it down because it was the only one in the province at the time. Now there's 2, and there may be more coming. They have many qualified doctors on staff, and lots of doctors have offices there in that hospital. My doctor's in that hospital. The number 5 hospital is Negros Polymedic Hospital. It's a new 100-bed private hospital that was opened on October 23rd, 2020. It's located in Silliman, which is just north, it's the hospital is just north of the airport. The airport is included in Silliman. It has 4 operating rooms, 2 of which are considered clean room operating rooms that will help prevent infections during delicate operations. Based on population, Negros Oriental should have 1,500 beds total among all the hospitals. That way they can handle the patient load of the province. The hospitals are coming up short with only about 700 beds among the 5 hospitals. There are 2 new hospitals coming up, one in Tanjay, which is north of Silliman, and the other in Bayawan, which is south of Dumaguete. And these 2 will help the situation, but I don't think that they will still be reaching that 1,500 beds. A couple things you want to remember about healthcare in the Philippines is that it's a largely pay-as-you-go, although they do accept insurance. It's just that most of the people don't have insurance. Costs are much lower than, say, in the U.S., so you may not need insurance. We don't have insurance. We have paid as we went. They'll let you run up just so many costs before they will ask you to pay down the bill. Like when my wife was in the hospital, when it got to about 20,000 pesos, they wanted me to pay it. So I would go down at bill, and then they will continue the treatment. You'll also be given prescriptions at the hospital, and then it's up to you to get the medicine. They may have a pharmacy there at the hospital, but you do the footwork and you pay for the prescriptions. Then you bring them back to the hospital for them to administer. Now, my family, we have personal experience with Silliman University Medical Center and ACE Doctors Hospital. I personally prefer ACE. Now, my wife got sick about a few months after we got here. Took her to Silliman University Hospital, and they diagnosed her, and that place was packed in the emergency room. They told her that she needed to stay in the hospital at least overnight, and so they didn't have a bed, so they were going to put her in this wheelchair. The wheelchair didn't have any way of reclining, so you were just stuck sitting in this wheelchair all night long. I thought that was ridiculous. So let them know, and then they called over at ACE Hospital apparently, because they came back and said there was a bed over at ACE Hospital. We could move over there. So I said yes. They got us an ambulance and they took us over to ACE. Now they assigned us a doctor. She's a very fine doctor, and she has become our family doctor. We all go and see her in her office. Well, she has an office in ACE. She also has an office at Silliman, and I believe she also treats at Holy Child. And she's also a professor at Silliman University in the medical program. So, let's see. I believe that's the basic information on the 5 hospitals in the area. Now, I'd like to invite you to click on the like icon. This will let me know that this is the type of video you like to see, and then I can make more videos, and hopefully you'll enjoy those too. I want to thank you for watching, and I hope to see you in the next video. Thank you again.